Urinary tract infections have been treatable for at least 1,000 years. In the year 1078, the formulary of the Taiping era described an 8-herb combination known as Ba Zheng San, the 8 rectifications powder. Ba Zheng San has been extremely popular in most Chinese medicine clinics ever since, and even to this day we use it for what we call damp heat urinary retention, which is the pattern most UTIs fall into. UTIs are potentially dangerous if left untreated. Patients can develop serious kidney infection or life-threatening sepsis, and this is especially dangerous in elderly patients who may not experience the typical symptoms of a UTI, but present with other issues like confusion or dizziness. UTIs can usually be treated effectively by antibiotics, but many patients will experience yeast infections afterwards, and because of the damage to their microbiome, have a greater likelihood of developing recurrent UTIs, which can then become resistant to antibiotic therapy. If you're in that camp, Ba Zheng San might be a good contender for relief. A randomized controlled trial compared 4 weeks of Ba Zheng San to 1 week of antibiotics followed by 3 weeks placebo for recurrent UTIs. 122 participants were split into 2 groups. Ba Zheng San was superior to antibiotics for clinical cure rate, bacterial clearance, and at the 6-month follow-up appointment had fewer recurrences than the antibiotics plus placebo group. One more thing I'd like to say about this formula. Many people will criticize Chinese medicine for being unscientific and even potentially dangerous. To that, I would like to say that the original Ba Zheng San formula did contain a plant that in some cases had small amounts of aristolochic acid, a compound discovered in the 1950s which is potentially dangerous even at low doses. That plant has been replaced in the modern versions of the formula with one that has the same function but does not contain aristolochic acid. When science and tradition work together, we get the best outcomes for everyone. As always, please seek medical attention if you have the symptoms of a UTI. But if you're falling down the rabbit hole of recurrent UTIs or antibiotic-resistant UTIs, remember that botanical options may be a good choice to talk about with your doctor.